Ever feel like your grocery bill and your healthcare costs are sort of battling it out? But what if I told you the food you eat might actually save you money on healthcare, or maybe cost you more?
It's definitely true, those lines between health, finances, and just, being a consumer, I didn't worry about it yet.
And honestly, trying to sift through all the daily news, all the information to figure out what really matters, it feels like drinking from a fire hose sometimes.
Exactly.
That's why we do these deep dives. So today, we're going to cut through some of that noise. We're diving into some really fascinating findings aggregated by Consumers.App for June 2nd, 2025. Specifically from their Consumers360 News Commentary.
Right, and this commentary basically pulls together recent news and research, focusing on stuff that's, crucial for you as a consumer.
Our mission today is pretty simple.
Yeah.
Extract the most important nuggets from this snapshot, the things that make you go, okay, and help you see what they might mean for your life.
Okay, let's unpack this. One really insightful piece the commentary highlighted comes from Forbes. It looks at how a pharmacist-led approach could actually be a powerful way to, curb healthcare costs.
That feels a bit counterintuitive, doesn't it? Like, we usually think pharmacists are just behind the counter counting pills.
Mm-hmm.
But this research suggests their role could be much bigger, both financially and clinically.
Absolutely. The core idea is something called medication therapy management, or MTM, led by pharmacists. And the consumers' research shows this isn't just, checking prescriptions. It's about pharmacists actually providing personalized advice to optimize how people use their meds.
Okay, and the measurable impact, the studies mentioned, sound pretty striking.
They really are. So one key finding pointed to a 16% decrease in overall hospital visits.
16%, okay.
And get this, an 80% reduction in hospital readmissions, specifically because of medication-related problems, after pharmacists stepped in.
Wait, 80%? Just from pharmacist intervention? That feels enormous. That's not just a number. That's potentially stopping major health issues and, costly hospital stays.
Precisely. And think about older adults maybe taking multiple medications, polypharmacy, they call it. The financial savings identified there are really substantial. A systematic review mentioned showed potential annual savings of over $1,400 per patient.
Wow.
Just on medication costs alone.
Over $1,400 a year. That's real money back in your pocket.
And that's before you even count preventing bigger problems. That same review estimated over $5,000 saved per patient by preventing hospitalizations. This particularly impacted people in long-term care.
So bringing pharmacists more into the fold isn't just a nice clinical support idea. The data suggests it's a potential game changer for, the whole system's efficiency and cost.
Right. The commentary even talked about integrating pharmacists into pharmacy benefits managers, PBMs.
Ah, the PBMs. The companies managing drug benefits for insurance.
Exactly. And the insight here is that adding pharmacists' expertise into that PBM decision-making loop could help make sure patient health comes first, not just the bottom line. Their clinical knowledge can spot potential problems, optimize choices.
Which leads to better care and lower overall costs.
Right. Leveraging their understanding of complex drug interactions, especially for people with multiple conditions, seems like a direct path to fewer adverse events and avoiding those super expensive hospital visits.
Yeah, it sounds like optimizing medication plans and helping people actually stick to them. Adherence improves how healthcare resources are used. Fewer unnecessary visits, fewer readmissions.
It boosts efficiency, cuts major costs. It really makes you wonder why this isn't the standard model everywhere.
It definitely makes you think about how you might talk to your own pharmacist differently, or maybe what questions to ask about managing medications. Okay, shifting gears a bit. From managing illness, what about preventing it? The commentary also highlighted a really interesting piece from FOX News on MSN.com about diet and brain health.
Yes. This article's headline was, "Rates of dementia are lower in people who eat this specific diet," research shows. And that specific diet, it's called the MIND diet.
The MIND diet?
Yeah.
Never heard of it. What is that exactly?
So MIND stands for Mediterranean Dash Intervention for Neurodegenerative Delay. It's basically a hybrid diet. It takes the best bits from the heart-healthy DHH diet and the, generally beneficial Mediterranean diet.
Yeah.
And then it specifically focuses on foods linked to protecting the brain.
So it's actually designed with cognitive health as the main goal. What did the research aggregated by Consumers.App find about its effects?
Well, there was a large study, nearly 93,000 U.S. adults, and it found a pretty significant link. People who stuck more closely to the MIND diet had a lower risk of developing dementia, including Alzheimer's.
And was that effect seen across different ethnic groups?
Yes, the commentary noted that protective link was seen consistently across African American, Latino, and white participants in that big study, which is important. But the Consumers Research Commentary is careful here. It points out the complexities.
Complexities like what?
Well, it's hard to completely isolate the diet's effect, right? Other lifestyle factors could be involved. Or there's something called reverse causality. Maybe early cognitive changes make it harder to stick to a healthy diet rather than the diet itself preventing the decline.
The classic correlation versus causation problem in nutrition. Makes sense.
Exactly. So more research is definitely needed to really nail down that cause and effect relationship.
But it's not the only study pointing in this direction.
No, not at all. The commentary mentioned other recent studies, like one from Harvard's T.H. Chan School of Public Health, that also support the MIND diet, potentially reducing the risk of all-cause dementia in middle-aged and older adults. The evidence seems to be building.
So if you're interested in trying this, what are the key foods? What does the MIND diet really emphasize?
The big focus is on foods packed with brain-protective nutrients. Things like leafy green vegetables, berries, nuts, and olive oil. These are loaded with antioxidants, vitamins, healthy fats, stuff known to fight inflammation and oxidative stress, which are, thought to play a role in cognitive decline.
And is there actual physical evidence? Does it impact the brain itself?
Yeah, the commentary mentioned imaging studies suggesting that lifestyle changes, including diets like MIND, might help maintain cognition and even influence key brain markers, like the volume of the hippocampus or cerebral blood flow.
Interesting. So what's next for the researchers?
They're looking at longer-term studies, trying to see the diet's impact on dementia markers before symptoms even show up. And also how combining the MIND diet with other healthy habits like exercise might boost the benefits.
It really highlights how powerful your diet could be, not just for your body, but for your mind's future too. Makes you think, could you realistically add more leafy greens or berries into your routine?
Seems like a pretty doable starting point for many people. Okay, so moving from broad dietary patterns to more specific tools, the commentary also covered developments around certain medications, often tied to diet discussions.
You mean the GLP-1 receptor agonists? Drugs like Wegovy and Zepbound, the ones getting lots of attention for weight management. This piece was from MedPage Today on MSN.com called GLP-1 Nutrition Guidelines.
That's the one. And the Consumers research pointed out a really significant recent change: pricing. It's starting to affect who can actually access these drugs.
Price changes. I thought these were notoriously expensive, especially if your insurance didn't cover them.
That's been a huge hurdle, but the commentary noted recent price drops, specifically for people paying out of pocket or without insurance.
It is a significant reduction. That could potentially open the door for a lot more people. So, besides weight loss, what are the main uses for these, like semaglutide?
Well, semaglutide originally got approved back in 2017 for type 2 diabetes. But, as the commentary explains, its role has really expanded into long-term weight management for people with obesity or those overweight with related health issues. It's known to be pretty effective at reducing appetite and body weight.
And tirzepatide, how does that one work?
Tirzepatide is also for weight management, but it has a slightly different mechanism. It mimics two gut hormones. It's a GIP analog and a GLP-1 receptor agonist.
Two hormones, okay.
Yeah, GIP is another one involved in blood sugar and appetite control. So it hits two pathways. And like any drug, the commentary notes potential side effects: nausea, vomiting, diarrhea, sometimes decreased appetite or constipation.
The research also hinted at another potential use for these drugs beyond diabetes and weight. Something about liver health.
Yes, that's a really promising area. GLP-1 agonists are showing potential for treating non-alcoholic fatty liver disease, NFLD. Because they help with blood sugar and weight loss, they seem to reduce fat buildup in the liver, that's hepatic steatosis, and improve overall metabolic health. It could be a new treatment option for what's becoming a very common condition.
It's clear these medications are evolving fast, both in how they're used and who can get them. Understanding these changes is pretty key if you're navigating treatment options.
Absolutely. And, it brings us back to that broader conversation about nutrition access and health. The commentary also looked at a piece from the Philadelphia Tribune, Tips for Finding Good Nutrition, which kind of zooms out to the systemic issues.
Right. This one talked about the root causes of food insecurity in the U.S. What did the research identify as the main drivers?
Well, the number one issue is simply not having enough money to buy food, even though, the U.S. actually produces plenty of food overall.
Right.
The commentary also points to things like neighborhood deprivation, living in a food desert without easy access to grocery stores, and even agricultural policies playing a role.
So it's not just about having enough food, but specifically not having access to nutritious food.
Exactly. And the health impacts highlighted in the research, they're pretty stark. Food insecurity is strongly linked to higher rates of chronic diseases like obesity and diabetes. The commentary even mentions that food pantries, while obviously vital, often end up distributing highly processed, less nutritious foods because of supply issues, which can, unfortunately, sometimes make those health conditions worse.
There was a surprising statistic in there about diabetes and food pantry users.
Yeah, the research cited found that 33%, a third, of households visiting U.S. food pantries had diabetes. That connection is just crystal clear. It really shows how tackling food access is fundamental to public health.
So what strategies did the commentary mention for dealing with this really complex problem?
Nutrition education programs came up as highly effective. Things like EFNEP and SNAP-Ed, they give people practical skills how to plan meals, budget for healthy food, cook nutritious meals. They empower people.
That ties right into that food is medicine idea, doesn't it?
It really does. The commentary stresses that providing nutritious food is medicine, especially for conditions like diabetes and hypertension that get worse with poor diet. So organizations focusing on distributing healthier food are crucial.
And the pandemic really threw this whole issue into sharp relief, didn't it?
Oh, absolutely. The research showed COVID caused a huge spike in food insecurity rates, roughly doubling them. And households with young children were hit particularly hard. It just showed how fragile food access is for so many communities when the economy takes a hit.
The commentary broke down food security itself into 4 pillars.
Right. Availability, access, utilization, and stability. Availability means enough food exists. Access means you can physically get to it. Utilization means you can prepare and use it properly for nutrition. And stability means you have consistent access over time. You need all 4.
What about community-level solutions? Anything mentioned there?
Yeah, things like community gardens were mentioned, increasing local availability of fresh produce. And improving transportation options can directly help people get to grocery stores or markets. These are real, tangible things communities can do.
It's such a reminder that our personal food choices are tangled up with these much bigger economic and system-level factors. Understanding that can really shape how we think about food policy and support in our communities. Okay, speaking of diet quality and health, let's swing back to heart health with a piece from the Times of India on MSN.com. Title was, Experts reveal that this diet can reduce heart disease risk.
Yeah, this piece really hammers home a message we're seeing again and again in the commentary. The quality of your diet deeply impacts your risk of heart disease.
What specific dietary patterns came up as being good for the heart?
Well, the research confirms healthier diets generally lower cardiovascular risk. High adherence to patterns like the DHH diet, for example, significantly cuts the risk of both coronary heart disease and stroke. It really seems to be about the overall pattern, being consistent rather than super strict rules.
What about the whole low-carb versus low-fat debate?
Yeah.
Did the commentary's sources touch on that for heart health?
This finding was interesting. It seems both low-carb and low-fat approaches can benefit heart health.
Okay.
But the key condition is that they have to emphasize whole plant-based foods. So it's less about the carb-fat percentage and more about the quality within that structure, minimizing processed stuff, maximizing nutrient-dense foods. The research does note more study is needed. Individual responses can vary.
But the Mediterranean diet still seems to be a gold standard for heart health.
Oh, absolutely. It's consistently linked to lower all-cause mortality and reduced heart disease risk. Plus, it's effective for weight management. It's widely recommended focusing on veggies, fruits, whole grains, legumes, nuts, seeds, olive oil, fish, and limiting red meat.
Did technology come up at all in managing diet for heart health?
Yes, this is a fascinating angle. The commentary mentioned emerging tech like NutriVision. It uses smart healthcare computer vision, AI. The idea is you could snap a picture of your meal and the tech analyzes it, estimates portions, gives you personalized nutritional feedback based on your goals, like managing heart risk.
That sounds pretty futuristic, but potentially really powerful for managing your diet in real time.
It could offer a level of detail and feedback that's tough to achieve just by tracking manually. The commentary also pointed to an NIH study stressing that poor diets are major drivers of cardiometabolic diseases, heart disease, stroke, type 2 diabetes. And importantly, improving diet quality is directly linked to lower mortality risk from these diseases.
And connecting back to food insecurity, the research highlighted that economic food insecurity increases the risk of heart failure and coronary heart disease.
Exactly. It just underscores that while your choices matter, those socioeconomic factors heavily influence your ability to make healthy choices, impacting outcomes like heart disease. The bottom line is clear. Prioritizing high-quality diets rich in whole, unprocessed foods is fundamental for long-term heart health.
It's empowering, but yeah, also a bit daunting when you think about the access piece. Okay, let's bring all this down to the most practical level, grocery shopping. The commentary also pulled from Health on MSN.com. I'm a dietitian. Here's exactly what I buy at the grocery store for a high-protein diet.
Right. This one gets really actionable down to what goes in the cart. So what were the main protein sources recommended from that dietitian's perspective?
Okay, the key groups mentioned were lean meats, think chicken, turkey fish like salmon and tuna, dairy options like cheese and yogurt, and then plant-based sources like beans, lentils, and nuts. The research notes these give you those essential amino acids for muscle building and just general health.
It's important, though, the commentary also included a bit of a warning about protein intake.
Ah, right. Can you actually have too much protein?
Apparently, yes, especially if you have kidney issues. Excessive protein can lead to problems like protein toxicity, where waste products build up. Mild symptoms might be nausea or loss of appetite, but severe cases could potentially cause seizures or kidney damage.
So balance is key. Moderation.
Definitely. And being mindful of any existing health conditions is crucial.
And circling back to tech again quickly, any tools mentioned for tracking protein specifically?
Yeah. The commentary mentioned NutriVision again for general tracking and also something called DPF nutrition systems. These use image analysis specifically to estimate nutritional content, including protein, and they're apparently getting better at figuring out portion sizes from photos, which is always the tricky part.
That could be really useful if you're focusing on specific macro goals. What about vegetarians trying to hit protein targets and get other nutrients?
The research acknowledges vegetarians need to be a bit more mindful about getting enough of certain things, like selenium and vitamin D. But it also highlights great plant-based options, like beans for amino acids and mushrooms for vitamin D based on their nutrient profiles.
Okay, so for someone actually standing in the grocery aisle, what are some concrete go-to high-protein items the research mentioned?
The article lists really common things: eggs, chicken breast, tofu, beans, and seeds like hemp or pumpkin seeds. Basically versatile, nutrient-dense protein sources.
And finally, the commentary noted some common misconceptions around high-protein diets.
Yeah, it briefly touched on criticisms, sometimes aimed at very strict high-protein diets like Atkins, about potentially unbalanced nutrient intake. It just reinforces that overall theme. A balanced approach focusing on nutrient density seems best for long-term health, no matter the specific diet label.
Wow. So whether you're trying to manage a health condition, protect your cognitive function, boost heart health, navigate food access issues, or just, make a better grocery list, the information pulled together in this Arpenia.
Consumers.App commentary offers some really powerful insights.
Absolutely. From using pharmacist expertise to potentially save money, to understanding how diet hits your brain and heart, and even getting those practical grocery tips. We've unpacked some key findings from the snapshot of recent research and news. Well, thank you for joining us on this deep dive into the source material aggregated by Consumers.App. Remember to like and subscribe to Consumers360 for more insights derived in the information aggregated by.
And as you think about everything we covered today, the power of food, the role of medications, those bigger access issues, maybe ask yourself, what simple change could you make to your daily habit that might have a surprise ripple effect on your health or maybe even your finances?
Something to chew on until our next deep dive.